The predictions about the catastrophe.
As another therapy for Ebola is already being tested on Americans with COVID-19, but it's still unclear when any of these treatments will be widely available.
The State Department raised the travel advisory to the highest level, to level 4 in its office.
Dr. Anthony Fauci, the government's top expert on infectious diseases.
Good morning, everyone. This is Dave with Marketing Ideas for Printers. I'm with you today with episode number 4 of our ongoing series with the coronavirus pandemic that set in with all of us, episode number 4. And just wants to remind you, first of all, thank you for attending. I just want to remind you that the purpose of these webinars is to provide the resources to help printers survive now and thrive later. And that's really just top of mind for us. We want to make sure that we're bringing value to you in these webinars. And so far, the feedback we've received after these webinars has been really just very outstanding. So it sounds like that value is hitting everybody. So thank you for attending this webinar. I've started to feel the need almost to add a disclaimer of why there's a bed in my background, because someday we'll all be watching these recordings and wondering, why is there a bed in the background? And of course, in today's world, so many of us working remotely, that's why, of course, the kids have the preferred spots for their home school, what used to be classroom, it's now home school. So they've got the preferred spots. I get the bathroom. Let's see, a few other things that we want to say. Just one thing that really just hits me over and over again is the things that we're learning during these days. We're learning lots of things about how to work with within this environment that the coronavirus pandemic has put on us. And I still, every day, I just see more and more silver linings. Yeah, we're getting through this really junky period right now, but I'm seeing more and more silver linings that are evidence that the lessons that we learn today can be applied in the future, and we're going to come out of this even stronger. So I'm really excited about the future, but for now, let's get through today. Reminder that the ideas that we share here are appropriate for all printers. So even if you're not a Marketing Ideas for Printers subscriber, you're still going to be able to get these ideas and use those. Some of those ideas will be fine-tuned for our Marketing Ideas for Printers subscribers. So just kind of keep that in mind. We might show a little bit of that. That won't be the case today. This is a very broad general topic, and we'll get to that in just a moment. Just a few more housekeeping items is the recording of today's webinar will be posted, as always, on coronavirusresourcesforprinters.com. And there's going to be a survey right after the webinar is done. It takes just a few seconds. I'd appreciate it if you can stick around and complete that survey. It's an opportunity for us to just get a little more feedback from you. It's a great opportunity for you to ask questions and give us ideas on topics. And that's exactly where today's topic came from. It was one of the questions on one of the survey follow-ups. Is a question about direct mail and the safety of direct mail in today's environment. So that's a little teaser about what's just around the corner. Provide feedback during the webinar too. We can't always get to the questions that are asked during the webinar. Well, we can't always get to them in real time, but we do look at those. We look at every piece of feedback that comes, whether it's the survey afterwards or question during the webinar. So if you have questions during the webinar, please ask them. And if we're not able to get to those in real time, we look at them afterwards and we will follow up. Remember, this is only temporary. As I'd mentioned before, the lessons that we learned during this time, we're going to come out even stronger. We will get through this together. Let me share my screen, and my apologies, I did not have the first screen up here, so give me just a moment to reconfigure my my screen and we'll bring up my browser window here. There we go. And this is coronavirusresourcesforprinters.com. And the parts that I wanted to show you, show this on previous webinars too, but there's a couple of important things that I want to call out here. Of course, the webinar sign up, if you're watching this by recording, this is where you can go to sign up for the webinars. Each one is new content, no repeat information here, other than maybe recapping, which I'm doing now. But the webinar itself is going to be new content. Here you've got the previous webinars. And here's the one thing that I really wanted to point out is we've got this free postcard that you can use just to let your print buyers know that you're there to help during this time, not only now, but afterwards too. So this is free. This is our gift to you. If you've not already picked up this postcard, please go there and grab a copy of this for yourself. You'll get the Adobe InDesign document and all of the related graphics files that you need to be able to produce and personalize and customize and produce this postcard. So please do that. The other thing I want to point out is we have this survey down here. This is not the survey that follows the webinar. This is an independent survey, so I want to make sure you're aware of that. And you can always click into that and take the survey, and you'll always see the results updated daily on here too. So this is a survey about how other printers, just like you, are faring in this coronavirus pandemic. And so go ahead, take that survey. You can look at what other printers are saying, compare yourself to where you're at in there. And that's helpful information for us too. So we appreciate if you can find a few moments to take that survey. All right, I'm gonna go back to here. And just for a brief moment, I want to bring your attention back to episode number 1. I'm not going to play it. I'm really not going to do anything other than say that the focus of episode number 1 was how crafting a message that's well received by focusing on others. And others is an acronym. You'll see that if you watch the replay. It's really about getting a good message out there. And using that to kind of bridge the gap into what we're going to talk about today. And that's direct mail and specifically the safety of direct mail, but the message too. We always have to, of course, be really sensitive to the message that we're putting out there, and that's why I referenced that first webinar. But I also want to encourage you, and also encourage you to encourage your customers that this is the time to lean into marketing efforts. This is the time where we need to get positive messages of hope and encouragement out there, and just really helpful messages too. There is a need for print. I'm preaching to the choir, you know that, but let's keep that message going that print is essential. And that's what we're going to talk about here. And I'm going to start it off with a poll here, and you can all participate. I'd ask you to go ahead and participate in this poll. And here it is. It's on your screen now. And the poll is in progress. So go ahead and start sending in those votes. And the question is, are your customers asking questions about the safety of sending mail as related to COVID-19? Go ahead and send me in your answers. The answers you can provide are they are not mailing right now, so they're not asking. They are mailing, but generally don't have safety concerns. You're getting a lot of questions about mail safety. I'm sorry, I said that wrong. That's answer number 3 is I'm getting some questions about mail safety. And then that last answer that you can provide is I'm getting a lot of questions about mail safety. So let's see where we're at here. Looks like the votes are rolling in, and I'm going to go ahead and close the poll. We'll put that up so that you can all see where you landed here. And we'll put those results, and there it is. Number 2 is the big winner today. They're mailing, but generally don't have safety concerns. Wow, that is the best possible answer. That's the answer we want them to have, or want you to have on their behalf. Glad to see that they're mailing. Also do see some responses on question number 1. I'm sorry, answer number 1 to this question, that they're not mailing right now, so they're not asking. That's where you want to go back. If they have mailed before, this is the time to encourage them to lean into those marketing efforts. And so I'm going to go ahead and close that poll now. And here is some of that information that you can use to encourage them that, yes, it's okay to mail. So let me get another screen shared here. Bear with me another second. And as I bring this up and rearrange some of my screen here again, here's the question that came in from one of the people that attended a previous webinar. Melissa asked, wondering how I talk about direct mail with my customers. I have a lot of customers that use direct mail services, and while I haven't had the direct question yet, I wonder about the potential to spread COVID-19 via the mail. USPS says there's little or no risk, but what say you guys? Any good info sources for me to share with customers? Thank you, Melissa, for asking that question. Appreciate you asking. And so we did a little digging here, and you're right. We've got the official USPS statement front and center, and that's kind of the top of the food chain. So we definitely want to pay attention to that. And just as a side note, I'm going to go through about a dozen or so websites. And these are screenshots because I wanted to highlight different parts of those. We're going to include the links to the websites that I'm referencing. That'll be included with the webinar recording at our website, coronavirusresourcesforprinters.com. So let's dig into the detail of that question. And we start here right at the top of the food chain, as I mentioned, the USPS statement on coronavirus. Oops, let me get that back here. So their statement, the important part for our needs here is, importantly, the CDC, the World Health Organization, as well as the Surgeon General have indicated that there is currently no evidence that COVID-19 is being spread through the mail. So there's the first piece of information you can take to any of your customers that would express a concern. But let's keep on going. Let's go a little bit further on down the food chain. And the next step is we're going to take a look at the CDC and the World Health Organization websites. And if you get to the right spot, you can remember I'll get the links in the webinar recording notes afterwards. If you get to this page, you can see things that we already know. We've heard this many, many times, but it's important just to really understand it and hear what's being said out there. So the virus is thought to be spread mainly from person to person between people who are in close contact with one another within about 6 feet through respiratory droplets produced when an infected person coughs or sneezes. Okay, it's the droplets. You've heard that over and over again. I suspect you have. But we need to keep hearing that. We need to keep reminding people of that it's the droplets that are doing the infecting. It's not actually touching other things here. But it's still a concern. We're going to keep diving in a little bit deeper here. So here's the next part: spread from contact with contaminated surfaces or objects. So it is the droplets, but those droplets, of course, do land somewhere. If they land in your respiratory system, that's of course not good. But if they can land on other surfaces, and that's the CDC statement, it may be possible that a person can get COVID-19 by touching a surface or object that has the virus on it and then touching their own mouth, nose, or possibly their eyes. But this is not thought to be the main way the virus spreads. Okay, so direct mail still getting a good pass on this. Let's move over to the World Health Organization. And again, we'll drop down to this question. Now we're getting a little more specific. Is it safe to receive a package from any area where COVID-19 has been reported? Is it safe? Their answer is yes, a definite yes. The likelihood of an infected person contaminating commercial goods is low, and the risk of catching the virus that causes COVID-19 from a package that has been moved, traveled, and exposed to different conditions and temperatures is also low. So that COVID-19, it's kind of an annoying thing, but still kind of a weakling. It's not going to do well with travel and temperature changes here. All right, so now we're going to go one layer further away from the source here, and we're going to go into some of the news websites. And, you know, I think we all need to kind of take that with a grain of salt, of course, because it's news, and of course, news is going to have their own, I don't know if I dare to say agenda on that, but let's face it, there's an agenda out there that that every news source has. So anyway, I'll stay off that soapbox, but let's take a look at what some of the news sources has, because that's what your customers are hearing. That's what the public is hearing. And so if we look at ABC News, just going through some of the highlights, tests led by US government scientists found that the virus can live on cardboard for up to a day, but that was in a controlled lab situation and does not reflect what might happen in daily life or with other materials such as envelopes. In the real world, packages and envelopes face varying weather conditions that affect how long the virus can live on them. Even if the virus was on the mail, it would need to make its way to your mouth or nose to cause infection. As long as you wash your hands thoroughly and regularly after opening it and don't touch your nose and mouth, that mail itself, that package, poses very little risk, Fisher said. So again, you can go to the ABC News story here. Let's keep going. Let's go to the New York Times. In an experiment that might better, before I go into this one, this is a pretty interesting one. This has a lot of different deep areas on this New York Times stories. All the different scenarios that might lead to, well, not scenarios, but maybe lab environments that would lead to how the virus spreads. But it has to be part of the real world here too. And so that's what this part is. In an experiment that might better mimic the effect of sneezing on a letter, researchers from Hong Kong University pipetted droplets of SARS-CoV-2 onto various surfaces. Their results, which have not yet been peer-reviewed and do not include details on temperature and humidity conditions, found no infectious virus left on paper after 3 hours. Although alarmingly, a significant level could be detected on the outer layer of a surgical mask after 7 days. The bottom line is that there is some hypothetical risk of viable virus surviving on mail, but given the time periods involved, this seems like a pretty minimal risk to the general public. All right, let's keep going. That was New York Times. The next one on the list is Philadelphia Inquirer, which says, right off the headline, can I get coronavirus from mail or food delivery? The risk is tiny. You can make it even smaller. Going into the story, that raises some questions. Can I get infected from the mail? What if the person who makes the food is sick? Could a sick delivery person transfer the virus to me? Good news, the risk is small. As the virus has spread across the globe, newspapers, mail, and food delivery appear to be generally safe. Couple more. Let's go to the Newsweek. This doesn't mean that someone should be leery of bringing in the mail, though. When asked if it was safe to receive a package from an area where COVID-19 cases have been reported, the World Health Organization answered, yes, it is safe. There's a low risk of catching the virus from a package that's been exposed to different conditions and temperatures, according to the World Health Organization. You're seeing the theme develop here. The Today Show, letter carriers and mailboxes just don't seem to be the most important or even any relevant aspect of COVID-19 transmission, Vinetz told Today. He wasn't worried about the public handling letters, UPS parcels, or Amazon packages as long as they kept up their hand hygiene, which we need to do anyway. The virus doesn't infect people through the skin. It only infects people through the respiratory tracts. So gloves, not a big deal if you're wearing or not wearing gloves. It's got to get into the respiratory tract. And I want to be careful. I'm saying not a big deal. Yes, it is a big deal. This whole thing is a big deal. But we also want to make sure that we're infusing the common sense that it's the respiratory tract that we got to watch out for. And gloves may help you keep things away from your respiratory tract. I don't want to try to pretend to be a scientist. So it's a big deal. I want to be careful on how I say that. Don't misinterpret that, please. Let's keep going. USA Today. Whether it's a package that comes in the mail delivered by Amazon or a letter from the USPS, it's no different than going to the grocery store or going to get takeout food. If you feel safe getting your food, you can feel safe getting your mail. CBS News. There is currently no evidence that COVID-19 can spread through the mail. In general, because of poor survivability of these coronaviruses on surfaces, there is likely very low risk of spread from products or packaging that are shipped over a period of days or weeks at ambient temperature, according to the CDC. Currently, there is no evidence to support transmission of COVID-19 associated with the imported goods. Three more. CNN, as packages go through multiple days or weeks of delivery, they faced various temperatures that coronaviruses are not likely to survive. And let's go a little bit more closer to health. Got two more to finish up with here, and this is health.com. Let me see if I can get right to the middle part of this. It is likely that the temperature outside and the length of time the package is in shipping may impact the survival of the virus on that surface. He says that's in contrast to lab settings viruses are usually tested in. All that's to say, of course, that even if coronavirus did make it onto a package, it would not likely make it to your door. Now, I'm going to spin this a little different direction. I'm going to go to Mayo Clinic's website, and of course, they have a coronavirus section on there. But let's take a look at this from a different perspective. If mail was a concern, wouldn't you think that a reputable site like Mayo Clinic would call that out? Well, if we look on their page, coronavirus disease, what is it and how can I protect myself? There is no mention of mail on this page. So you can have that safety or have that knowledge and relay that information and encourage your customers that direct mail is still a safe way to go. So hopefully those resources are helpful. Hopefully you can use those tools if you have your customers questioning the safety of direct mail. That's some information that you can use to help give them reassurance and encourage them that direct mail is still an important part of our world these days. Okay, so again, these resources will be listed with the recording. We're going to wrap it up here pretty quick. The recording of today's webinar is going to be posted at coronavirusresourcesforprinters.com. If you find value in this webinar series and the resources we're sharing, please do us a favor. Please share that web page with your fellow printers. We'd appreciate that if you could help us get that word out. It's already getting out, but we're just excited that this might be able to spread. Let's make this spread faster than coronavirus. Remember to stick around for the survey. It's short. It can be as little as 15 seconds, but take more time if you wish, because that's where you can tell us how we can help you. A lot of your follow-up is being turned into tips and FAQs that we'll deliver by email or blog or perhaps on the future webinars. And remember, we will get through this together. Thanks for attending today. Stick around for the survey.